Herniated disc, causes, symptoms, treatment. When the spinal disc shifts and presses on the spinal cord, this condition is known as hernia nucleus pulposus, HNP. Another name for HNP is pinched nerve. Depending on the location of the HNP, pain in the lower back, waist, upper back, or neck can result from a HNP or pinched nerve. The majority of HNP diseases are self-healing. However, depending on the severity of the patient's symptoms, the doctor can prescribe treatment if the pain lasts for months. Hernia nucleus pulposus, HNP, is brought on by tissue weakness in the spinal discs. The flexibility of the spinal discs will decrease as we get older, making them more vulnerable to injury. A person's risk of developing a pinched nerve can also be increased by a number of other factors, including: have a history of pinched nerves in your family. Are you overweight, lift heavy weights with the wrong support, perform sudden or repetitive bending and turning, or smoke? Symptoms. The symptoms of a hernia nucleus pulposus, HNP, include a hot back, mild back pain, or even no pain at all if the shifted bearing does not clamp the nerve. However, depending on the location and number of pinched nerves, symptoms will arise if the hernia is pressing on or pinching the spinal nerves. HNP can cause pain on the left, right, or both sides of the back that spreads to the legs or thighs. Depending on where the nerve is pinched, the following symptoms can occur. The symptoms of HNP in the neck. A type of HNP called cervical HNP also pinches the nerves in the neck. The signs and symptoms include: 1. Major annoyance and shoulder. 2. Shivering, shortcoming, or muscle firmness in one arm. 3. Consuming sensation in the neck, shoulders, and arms. Side effects of HNP in the lower back. Lumbar HNP, or a hernia that clips the nerves in the abdomen or lower back, can cause the accompanying side effects. Pain in the lower back or tailbone that gets worse when you move, pain that feels like a knife in the buttocks and spreads to one leg, tingling or weakness in the muscles in the legs. Although this rarely occurs, lumbar HNP can also make people unable to hold back urinating. When to see a doctor. If the pain in your back doesn't go away, spreads to your legs, or causes tingling and muscle weakness in your legs, you should see a doctor. Physiotherapy treatment. If you live in Pakistan, then you can contact us for proper treatment. Physiotherapy is one of the treatments for HNP. Consult the medical rehabilitation doctor on a regular basis if you are receiving physiotherapy for HNP, so that the results of the therapy can be evaluated. When a patient is diagnosed with a hernia nucleus pulposus, HNP, the doctor will inquire about the patient's symptoms and previous activities. The doctor will then conduct a physical examination, particularly a neurological exam. If the patient is thought to have HNP, the doctor will do supporting tests to figure out what's causing the back pain, like electromyography, EMG, which measures the electrical activity of muscles when they contract, is used to scan the spine with a CT or MRI. Hernia nucleus pulposus, HNP, treatment. The majority of HNP patients recover on their own within a few weeks or months. Patients are advised to lie down frequently and refrain from strenuous activities during this time. A pinched nerve can be treated in the following ways by a doctor. Treatment with medication, such as corticosteroid injections, muscle relaxants, and painkillers, physiotherapy, and spinal surgery, such as a microdiscectomy, if the aforementioned treatments fail to alleviate the patient's symptoms or make it difficult for the patient to stand, walk, or control their urination. Consequences of a hernia nucleus pulposus, HNP. Untreated pinched nerves can exacerbate pain and make it difficult for patients to move. Loss of sensation in the area surrounding the rectum and inner thighs. Permanent nerve damage leading to paralysis. Cauda equina syndrome. Prevention of hernia nucleus pulposus, HNP. Although HNP cannot always be prevented, you can reduce the risk of a pinched nerve by making the following efforts. Maintaining good posture, such as sitting with a straight back, lifting weights in the correct position, or maintaining the ideal body weight to prevent excess pressure on the spine, requires quitting smoking because the nicotine in cigarettes can reduce the supply of oxygen to the spinal discs.